Alright, so we're going to do the practical assessment 1 here with my client Marshall. So I'm going to go over our PAR-Q with him, go over the consent form with him, explaining everything, take his resting heart rate and his blood pressure here with the cuff and stethoscope. So basically the PAR-Q here, Marshall, this is just going over any kind of health concerns, issues, kind of doctor. These should all be no answers, so I'll let you give this a quick read over here. Again, this is to ensure safety for liability issues and make sure he's ready to go, is cleared by his doctor if there are any issues, and so forth that. So he's good there. He's a young, healthy athlete, so he should be all right. He's 17 years old, so he's in the age group there. And again, here's our consent form for the adult, and this again just goes over. So we're gonna go over in the appraisal. So blood pressure, push-up test, if we're doing skin folds, vertical jump, just kind of covers everything there, so he knows what we're doing. Blood pressure measured prior to this. And again, assuming he answered no to all the PAR-Qs, we'll proceed to the assessment. And that, again, during the assessment, if on a particular test protocol there might be some shortness of breath, so that's standard, expected. It just kind of informs him of what we're going to be going through. So here, let him look over that again. Just a couple quick bullet points there. Good. So first I'm going to take his resting heart rate. So I'm going to take his hand here, his wrist up. I'm going to take it on the radial location here on the wrist. So 15 seconds, kind of count on the clock, and then count how many pulses, and then you can go from there to find the resting. Alright, so find it here, 2 fingers. And he's been resting 5 minutes now, so, or sitting here, so he's calm and nothing's elevated. So I got about 18 beats there in 15 seconds, so that'd be 72 beats per minute roughly for his heart rate. And we could take that again. Actually, well, I'll take that one more time just to confirm. Find the spot, wrist up. Perfect. Yeah, again, 17, 18, so again, you'd be right around that, the 70-ish, 72 resting heartbeat per minute. So, okay, now we'll move to the blood pressure, resting blood pressure. So to take this, we want him seated in the chair, left arm, again, resting, come down a little bit, so you want the elbow roughly heart level-ish, okay? So we're going to place the cuff on the arm, so up here. Hold that for a second, Marshall. Okay, so we want the artery here, brachial artery, coming down this side. So wrap the cuff around his arm, it's on there firm. I'm going to take the stethoscope, and so to take this, you apply the pressure up, right, to probably about anywhere from 140 to 150, and letting out, and then letting out, we're just going to go out down at 2 2 milligrams or milliliters per second. Okay, so nice, slow, even let down. And then the first when you start hearing the beat is going to be the systolic pressure, and when it stops, cuts off, that's going to be your diastolic. Okay, so get this on. So put the stethoscope right on the below the cuff here, right above the elbow. Make sure this is tightened. Pressure comes up. So about 150 there. Slowly release. Perfect. Alright, so what I got there for his systolic pressure, I got about 121, and diastolic was about 74. So his pressure's pretty good. And he's an active guy, so normal to be a little bit lower there on the diastolic, but yeah, so 120 over 71 for his resting blood pressure. Perfect.